Gentlelady from California, Ms. Matsui.
Thank you, Madam Chair. I want to thank Chairman Waxman, Chairman Pallone, and Chairman Emeritus Dingell for their leadership on this most important of bills. Over the last few months, I visited community clinics, hospitals, alcohol treatment centers, and emergency rooms in my hometown of Sacramento. I've seen how much of our healthcare system works for the people in my district and across our country. Integrated models of care, community-based interventions, comprehensive treatment programs for the mentally ill, all of these are key components of a well-functioning health system. But the glue tying these together is hardworking and extremely skilled doctors, nurses, pharmacists, therapists, and public health workers who live in my district and who drive its economy. I've met with many of these healthcare workers, and I've seen their dedication and commitment firsthand. But they need help. Our healthcare system is overwhelmed with demand, even as millions of our fellow Americans have no health insurance. One of the most effective strategies to ease the stress and strain on our healthcare system is to invest in public health and prevention. That is why I'm so pleased that two pieces of legislation I introduced earlier this year were incorporated into the underlying legislation the committee is considering here today. The Public Health Workforce Investment Act and the Wellness Trust Act are important components of a comprehensive healthcare system that help to make America a healthier, stronger, and more competitive country. Another way we do this is by providing quality health care to our children. Our children are our future, and I'm committed to working with my colleagues on this committee to ensure that we first do no harm when it comes to children's care. I also want to thank Chairman Waxman and the committee staff for working so closely with Mr. Engel and myself on language creating a new definition of federally qualified behavioral health centers. In the end, Mr. Chairman, Madam Chair, I support this legislation because of people like Claire Josephson. Claire is an uninsured constituent of mine, a nurse with diabetes. As the cost of medicine goes up, she will not be able to afford medication for very much longer. So even though this legislation is not perfect, I believe the underlying bill is strong and will go a long ways to help people like Claire, our children and grandchildren, and the millions of Americans across our country. Madam Chair, inaction is not an option. We must address comprehensive health reform now. Thank you, and I yield back the balance of my time.